Madam Chair, and thank you also for presiding over the hearing today. Just to recap, when the President's health card was passed back in 2010, the law was called for verifying individuals' income in order to determine if they're eligible to receive a subsidy. The administration at that time said, we're not going to enforce that provision. So Congress moves in, repasses legislation. The President signs into law that includes the provision, once again, that we will require income verification. But then today now we know that there are over 2 million people of the 8 million that are in the exchanges, and these applicants, that have unresolved inconsistencies. So that means 25% of applicants in the exchanges had discrepancies. This isn't a glitch. This is clearly a systemic issue. And so the May 17th Washington Post report showing that as many as 1.5 million people, there are cases of significant inaccurate subsidy payments now due to incorrect income data. In other words, there's no verification, resulting in millions of taxpayers, families being on the hook, potentially for billions of dollars in waste and fraud. And some of those cases bear out, I think, what Mr. Holzisen mentioned earlier in terms of the EITC. So we're no longer talking about hypothetical problems regarding the new health care law. We're talking about real risks that are in place now, and this harm is happening as we speak. And during next year's tax filing season, millions of Americans are going to find out that they owe the IRS money because their premium credits were paid incorrectly. And the IRS and then the administration in general is going to have to face a choice. One, they can go after innocent taxpayers, creating financial hardship and confusion for those millions of families. Or two, just choose to once again ignore the law and force other taxpayers to cover billions of dollars in excess premium credit payments. And those are both very, very bad choices, and it didn't have to be that way. That's what comes when you pass just a one-sided partisan law without bipartisan buy-in. But, Mr. Ellis, is this really how the law was supposed to operate?
Well, if you look at the actual letter of the law, it is operating the way it's supposed to operate. That speaks more to the process not having been thought through properly when the law was drafted. As you point out, if the IRS implements the law as written, it is going to face that very difficult choice between going after people who have very modest levels of income and savings in order to pay this overage, or simply ignoring their mandate to carry out the laws as written by the Congress.
And let me just follow up, because as a tax preparer, you know what questions to ask when people don't seek your when people seek your services. But what about the people who don't seek your services? Typically, how are they going to know? How are they going to know what they're responsible for as a part of verification? And aren't those typically lower-income Americans or individuals or families that aren't seeking your services that are going to be trapped in this situation?
Well, by definition, if you look at the upper band of who is going to be affected by this, people that are receiving premium credits at all, 400% of the federal poverty line is about $44,000 for a single person. It's about $90,000 for a family of four. So it's everybody between that and below, all the way down to Medicaid eligibility. So many of those people are not today using tax preparers. They will continue to file their tax returns or not, as they have up until the past. When they're going to find out about it is when they're going to get a notice of deficiency from the IRS after they file.
Mr. Holzeken, I just want to give you a chance to respond too, real quick maybe to that, or a couple of those points if you could.
I think that's exactly right, and my concern is that, for this population, they're going to be in uncharted waters, right? There's a question about whether some of the state exchanges will be able to get the information statements to the recipients, their subsidy payments. Once people receive it, will they know to hold on to it? This is something they need, or it was about that health thing they already did? Do they know to go to a preparer and thus send in a reconciliation form? If they don't send in a reconciliation form, my understanding is the IRS is simply going to reject the tax return and tell them to start over. That'll be a shocker, particularly if they're used to getting an EITC. It can be a bumpy ride in 2015.
All right. Thank you, Madam Chair. I yield back.
Gentleman yield.